The McGinley Clinic presents ultrasound-guided trigger finger release utilizing the augmented reality for ultrasound technology. This minimally invasive procedure is used to treat stenosine tenosynovitis, commonly referred to as trigger finger, a painful condition caused by progressive restriction of normal tendon motion which interferes with the ability to bend and straighten the fingers. Used in conjunction with McGinley augmented reality for ultrasound technology during this procedure, the Sonix Health's UltraGuide TFR further enhances patient care. Using McGinley augmented reality for ultrasound technology, the physician is able to overlay the ultrasound image upon the physical anatomy of the patient. This provides ergonomic benefits to the physician, as they can be comfortable while looking directly at the anatomy without having to turn their head in uncomfortable positions to view the ultrasound image. While working with such minute and critical structures such as nerves and arteries, it is critically important for the physician to visualize their hands and tools while performing the procedure. By overlaying the ultrasound image upon the physical anatomy, the provider can see in real time the anatomic structures and instruments, providing a safer environment for the patient and a more accurate and precise position for the physician. To begin, the patient is placed in a supine position, arms extended outward, palms facing upward, with a folded sterile drape under the patient's hand. Using the augmented reality for ultrasound technology, the physician will identify bony and soft tissue landmarks, including nerve branches, arteries, and tendons. Specifically, they will visualize the A0 pulley as a broad fiber across the flexor tendons, located directly palmar to the shaft of the third metacarpal bone. The physician can move the ultrasound field of vision distally to visualize the A1 pulley, which will appear thickened to the base of the third proximal phalanx. The A2 pulley can also be visualized in this location. The physician will use a marker to identify the entry point superficial to the flexor tendon. For this procedure, the marked line in distal palmar crease will determine the location for the incision. After performing the timeout protocol, the physician will prep the procedural area using sterile technique. They will then inject a numbing medicine to provide immediate relief and longer anesthetic for the patient after the procedure. Using the augmented reality in conjunction with the wireless ultrasound to visualize the anatomy, the physician will locate the targeted flexor tendon and identify the bony anatomy of the third metacarpal shaft. Additional numbing medicine will be injected along the tendon sheath, and subcutaneous tissues as needed. After lining up the targeted flexor tendon using ultrasound, a small incision is made. After isolating the flexor tendon sheath, the UltraGuide TFR device is advanced under the sonographic guidance along the flexor tendon deep to the A1 pulley. The physician can verify positioning with the cross-section view on the ultrasound. The visualization should show the device located superficial to the flexor tendon. The physician should not be able to significantly displace the device with back and forth motion. The cutting blade is now advanced into position under sonographic guidance. The blade is slid down the guide and placed just distal to the A1 pulley. The blade is then deployed, the pulley release performed in a slow and controlled fashion under the direct sonographic visualization. The physician and patient may feel and/or hear a grating sensation, which terminates when the A1 pulley is fully released. To verify the release is complete, the physician can again displace the device with a back and forth motion. It should now move freely. The physician can therefore confirm a complete release. The device is removed and the area cleaned. The drapes are removed to visualize the finger. The patient is asked to perform range of motion exercises, bringing the finger into position in which it usually triggers. If the procedure was successful, it should not trigger. Confirming a successful outcome, we then placed a transparent dressing over the incision site. After the procedure, there may be light bruising at the site. The patient is now able to leave the procedure room and can resume normal activities within 1 to 2 days. If you have symptoms of trigger finger, call McGinley Clinic at 1-866-ORTHO-WY or 1-866-678-4699 to schedule an appointment. The email for the clinic is info@mcginleyclinic.com. For inquiries or more information, please go to www.themcginleyclinic.com.